Did you know the number of pillows you sleep with could be a clue to hidden heart disease? Or that your eyes, skin, and nails can reveal how your heart is doing? Heart disease is something I see every day, and it's far more common than most people realize. Around half of American adults 40 may have some form of hidden or undiagnosed heart. You heard that right, half. That's tens of millions of people walking around right now with a heart condition they know nothing about. One of them could be you. Today I'm showing you 7 hidden signs of heart disease that could help save your life or someone you care about. These are signs you can look for right now. They're the same clues I look for when assessing my own patients. You don't need to be a cardiologist to spot them yourself. This week, let's get started. Number 1. How many pillows do you sleep with? Strange question, I know, but it's one of the most useful ones I ask for spotting hidden heart failure. What I'm really asking is this: can you lie completely flat and breathe comfortably? Or do you get short of breath when you lie down? The heart pumps blood from the lungs to the body and back. When it starts to struggle, blood can back up into the lungs, and fluid leaks into the lung tissue. Standing up, gravity keeps that fluid lower in the lungs. Lying flat spreads it evenly, making it harder to breathe, like breathing with a layer of water inside your lungs. This is called pulmonary edema. You can see it on a chest X-ray. The white areas represent fluid built up in the lungs. The tricky part is, these changes happen slowly. Most people don't suddenly notice breathlessness lying flat. They just start using an extra pillow, then another. After years of asking patients if they felt breathless lying down, I realized many didn't recognize the symptom. So now I ask a different question. How many pillows do you sleep with? So ask yourself, could you comfortably sleep completely flat tonight? Or do you need multiple pillows to breathe easy? Number 2, can you climb a flight of stairs? Sounds simple, but many people with heart disease feel completely normal during everyday activities. They go shopping, go to work, walk around the neighborhood. I've had patients with real heart disease who could still walk a mile without obvious problems. But stairs are different. Walking uphill or climbing stairs places much greater demand on the heart. That's often when symptoms first appear. If you're unusually short of breath at the top of a single flight of stairs, and it's a change from your normal fitness, it's worth paying attention to. Sometimes the earliest signs of heart disease only appear when the heart is pushed a little harder. Number 3, are your ankles swollen? This is one of the easiest signs to check yourself. Sometimes all you notice is your shoes feel tighter by end of day, or your socks leave deep marks around your ankles. What we're looking for is called pitting edema. Press firmly on your ankle or shin with your thumb for 15 to 30 seconds, then let go. If a dent remains in the skin for a few moments, that's pitting edema, fluid that's leaked out of blood vessels and collected in the tissue. This can happen when blood backs up because the heart isn't pumping effectively, the same basic process we talked about with the lungs. Swelling doesn't automatically mean heart disease. It can also happen with kidney disease, pregnancy, and other conditions. But alongside other signs here, it's worth a closer look. Number 4, is your pulse regular? There's a heart condition you can screen for right now using nothing more than your fingers. Place 3 fingers on your wrist, just below your thumb. Can you feel your pulse? Now pay attention to the rhythm. Does it feel steady and regular, or completely unpredictable? If it feels irregular, you could be experiencing atrial fibrillation. The heart has 4 chambers, 2 atria, 2 ventricles. Normally, electrical signals coordinate all 4 so they beat in an organized way. In atrial fibrillation, the atria fire chaotically and twitch instead of contracting properly, creating that irregular pulse. This matters because blood can pool in the atria and form clots. Those clots can travel through the bloodstream. If a clot reaches the brain, it can cause a stroke. If it blocks blood flow to the intestines, it can cause a serious condition called bowel ischemia. The good news, many modern smartwatches can detect irregular rhythms and alert you. But sometimes your fingers pick it up first. If you're finding this useful, subscribe and leave a comment. I've been treating patients, and I make these videos to share practical knowledge anyone can use. Number 5, watch your neck and fingernails. The heart has valves that keep blood flowing the right direction. One of the most important is the aortic valve. If this valve becomes leaky, a condition called aortic regurgitation, blood flows backward instead of forward, straining the heart over time. What's fascinating is this can sometimes be seen from the outside, visible pulsations in your neck or tiny pulsations in your fingernail beds, called Quincke's sign. Some people develop visible pulsations of the uvula, beckoned as Miller's sign, or a subtle head nodding with each heartbeat, called de Musset's sign. These findings are uncommon, but when present, they can be important clues to significant aortic valve disease. Number 6. What do your fingers look like? Try this. Place your index fingers together, then your thumbnails together. See a small diamond-shaped gap between the nails? Good. Now compare it with a normal reference. If that gap is missing, you may have a finding called clubbing. The fingertip becomes enlarged and the nail curves more than usual. It's often a sign the body has been exposed to low oxygen levels over time. Heart disease can cause it, but so can lung disease and other conditions. If you think you may have clubbing, it's worth getting checked by a healthcare professional. Number 7. Check your eyelids. Do you notice any yellow patches around them, especially near the inner corners of the eyes? These are called xanthelasma. They're deposits of cholesterol underneath the skin. Xanthelasma itself doesn't mean you have heart disease, but it can be a clue your cholesterol is abnormal. Abnormal cholesterol is one of the major risk factors for atherosclerosis, plaque building up inside the arteries, which over time can lead to heart attacks and strokes. So while xanthelasma isn't dangerous by itself, it may be a sign it's time to get your cholesterol checked. These signs don't necessarily mean you have heart disease, but they are clues, the same ones I use every day with my patients. If you notice any, don't ignore them. Talk to your doctor. The earlier heart disease is caught, the more we can do to prevent serious complications. If this helped, subscribe, drop a comment, and share it with someone who needs to see it.